enjoy working here because I feel like it's a little bit of atypical physiotherapy. I think that our specialization allows us to expand that scope of practice with physiotherapy, and that we also get to work a bit more with the medical team as well. So on our team, on that unit and also in the outpatient burns clinic, we also get to work with a physiatrist, a burns nurse practitioner, and a whole handful of nurses that help us to do our job best. And in the case of myself, where I work on the burns unit, I get to explore things like wound healing and dressing takedowns and all sorts of things that people wouldn't typically think of physiotherapy. I know that a lot of people typically think of like hips and ankles and backs when it comes to physio, but our scope of practice with the wounds and plastics team allows us to push that scope of practice a little bit more.
And then I also, 1 day a week, I work in the wound care clinic. So I do lower limb assessments for patients with diabetic foot ulcers or leg ulcers. I also am trained to do specialized footwear and sharps debridement, so that's a really cool area of practice. So sharps debridement is basically just using specialized instruments like scalpels to remove and debride dead tissue to help improve the healing process. And it's just a really cool hands-on area of practice where you're almost, when you're down in the clinic, it's almost like being in a private practice clinic where you get the fast-paced environment and being able to like have these conversations with patients and really provide education in almost like a private practice setting.
And our treatments are typically a lot longer than I would say on another unit. Our treatments can range from 60 to 90 minutes, and that could be a typical session. Whereas I know that on other units they tend to be about 15 minutes to 30 minutes or so.
And what do you do?
We do a lot of stretching, a lot of range of motion, and a lot of education with these patients. So when it comes to the burn injuries, they tend to, as they heal, the skin tends to get really tight, and you can imagine over top of a joint that can be really detrimental to a patient's range of motion and how they're able to basically get around and do all their ADLs. So our role as a burns therapist is to make sure that they're able to do all the things that they need to, whether it's walking around, going up and down a flight of stairs, going back to work, doing the things around the house that they need to do, like toileting, cooking, cleaning, those sorts of things. So a lot of it does come down to things like exercises, a lot of prolonged stretching to make sure that we're maintaining the range of motion through those joints. And then also, like I said, a lot of education so then for the future when they're discharged from the hospital, they know how to take care of their own injuries.